Okay, we're going to go ahead and get started. I'd like to welcome everyone this afternoon. My name is Nicole Bazilla, and I'm our Director of Pupil Services. Thank you for joining us today as we discuss trauma. As we know, trauma can impact students of all ages, emotionally, behaviorally, and academically. Today with me is our school psychologists and social workers who will speak to you about trauma and help us understand the types and signs. I will go ahead and turn it over to our school psychologists to get us started.
Sorry. I'm Christine Hardgrove. I'm one of the district school psychologists. If we could go to the next slide. So in the first part of this presentation, we define the term trauma. We will also identify different types of potentially traumatic experiences for children and adolescents, and we will examine the research on rates of childhood trauma. We all experience some level of stress on a regular basis, whether at work or at home. Daily stressors such as deadlines, meetings, traffic, and juggling family needs are common for most of us. We also face more intense experiences like illness, caring for an aging parent, ongoing stress at work, financial pressures, or dealing with major loss. And even positive experiences like getting married, moving, or starting a new job can also cause some level of strain. In many cases, we all have the capacity to cope with these range of life experiences, expected or unexpected, mild or intense. And at times, individuals may feel unable to cope with high levels of stress. And when this occurs, it may lead to trauma. So what is trauma? Trauma is generally results from actual or perceived harm to one's physical, psychological, or emotional well-being. It is the inability to cope, and there is some kind of impairment in daily life or functioning. Essentially, it is an individual's response to stress. Now, it's important to remember that not everyone experiences a traumatic reaction to stress, but for those who do, it is important to remember that a traumatic reaction is not an attitude or a choice. It is a physiological and psychological reaction to stress. In this presentation, the term trauma is used to describe an event or series of events or set of circumstances that is experienced as physically or emotionally harmful or life-threatening. It overwhelms our ability to cope and has lasting adverse effects on a person's mental, physical, social, emotional, and/or spiritual well-being. So thinking about the 3 E's of trauma, traumatic events that students may face at school and in their families and in the community come in many forms. They range from one-time incidents such as accidents, a natural disaster, the loss of a parent or peer, or single experiences of violence to experiences that are chronic or even generational, such as abuse, neglect, chronic bullying, exposure to family or community violence. And whether an event or circumstance is traumatic depends on the person's experience of the event. We cannot always say that a particular situation, such as witnessing domestic violence, for example, is always traumatic for everyone. Whether an event is experienced as traumatic is influenced by many factors, including our internal coping resources, our external supports, and broader community, cultural, and societal factors that shape how we understand and respond to our experiences. And then traumatic experiences may have short and long-term effects on health and well-being, and they can alter how children and adolescents view themselves, others, and the world around them by challenging their belief of the world, that the world is a safe place, that other people can be trusted, and that they are worthy of care and protection. Students feeling this effect of trauma may show in their work and behavior at school. Some traumatic experiences come in many forms. Like I said, they range from one-time events to experiences that are chronic or generational. Potentially traumatic experiences for children and adolescents may include natural disasters such as hurricanes, fires, and floods. Human-caused disasters such as accidents, wars, environmental disasters, and acts of terrorism, community violence, such as robberies, shootings, assault, gang-related violence, hate crimes, and group trauma affecting a particular community, and school violence, including threats, fights, school shootings, chronic bullying, and loss of a student or staff member. Some other potentially traumatic events for students include family trauma, including abuse and neglect, experiencing or witnessing domestic violence, incarceration of family members, family substance abuse, and sudden or expected loss of a loved one. There is refugee and immigrant trauma, such as exposure to war and political violence, forced displacement and fears of deportation. Medical trauma, which is pain or serious illness, invasive medical procedures or treatments. And there is also experiences associated with poverty, including lack of resources and support, financial stressors, and related experiences such as homelessness. Historical trauma is defined as the cumulative emotional and psychological wounding across generations, including the lifespan which emanates from massive group trauma. Some groups that continue to be impacted include American Indian and Alaska Native communities, communities of color, immigrant populations, Holocaust survivors, and members of the LGBTQ+ community. There's also racial trauma or race-based traumatic stress, which refers to potentially traumatic experiences resulting from direct experiences of racial harassment, including threats of harm or injury and being humiliated, witnessing racial violence towards others, such as hate crimes or injury, or violence by law enforcement, and experiencing discrimination and institutional racism. The term complex trauma describes both exposure to multiple traumatic events from an early age and the immediate and long-term effects of these experiences over the course of development. And examples of this include chronic abuse or neglect or exposure to family violence, as well as other forms of violent victimization experienced at an early age without adequate adult support to manage these experiences. This type of trauma is particularly devastating because it occurs during a critical periods of brain development before a child has had the chance to develop strong positive ways to cope with stress. Youth with complex trauma are likely to exhibit a range of behavioral and academic difficulties that require additional intervention by adults in the school and in the community. And we'll talk about what this looks like later in the presentation. And risk of trauma exposure is higher among certain groups of students based on their particular experiences, both historically and at present. Youth of color ages 12 to 19 are victims of violent crime more often than their white peers. Youth of color are also 3 times more likely to be victims of robbery and 5 times more likely to be victims of homicide, which is the leading cause of death among youth of color ages 15 to 24. African American youth living in urban low-income communities are more at risk of exposure to violence than any other population in the United States. American Indian, Alaska Native children and youth are 2.5 times more likely to experience trauma than their peers. And other groups at increased risk of exposure to trauma include children and youth who have disabilities, who are refugees, have experienced homelessness, live in poverty, or are members of the LGBTQ communities. And now I am going to hand it off to Dr. Stevenson.
So to understand the impact of trauma, we have to consider how the brain and body respond to stress. I'm going to be reviewing the key parts of our stress response system and how the system works to keep us safe. What happens when stress becomes traumatic and common responses that children and adolescents have to trauma reminders or triggers. Next slide. So our brains have a built-in alarm system that is designed to detect a potential threat and help the body respond quickly and effectively to keep us safe. There are three main parts of the brain that play a role in the stress response: the brainstem, the limbic system, and the neocortex. The brainstem is located at the bottom of the brain and controls all major systems needed to keep us alive, including heart rate and our breathing. The brainstem prepares the body to react in a threatening situation. The limbic system is the emotional control center of the brain. This part of the brain helps determine how we feel about an experience. For example, whether it is pleasurable or frightening. It looks out for danger and reacts accordingly. Within the limbic system, there are two areas that play a key role in the stress response: a structure called the amygdala and a structure called the hypothalamus. The amygdala acts like a smoke detector to identify a potential threat and sound the alarm. The hypothalamus hears the alarm and communicates that message to the rest of the body so that we are prepared to respond. Together, the limbic system and the brainstem can be thought of as the emotional brain. The neocortex is the last part of the brain to develop and is known as the thinking brain. This part of the brain is responsible for reasoning, planning, problem solving, making meaning of our experiences, and regulating our emotions and behaviors. When faced with a threat, the thinking brain helps us decide when we are actually in danger and helps us return to a state of calm after a threat has passed. Sorry, one second. Next slide. So now we're going to walk through the stress response to break down what is happening when our body is responding to a potential threat. First, the emotional brain senses a threat and sounds the alarm and sends the message so that the body will react. This happens at an automatic and unconscious level. For example, if you hear a loud noise, you immediately jump before you even know whether you're in danger. It is important to remember that when faced with a potential threat, we react first and then think second. Next, the thinking brain assesses the situation to see whether the danger is real or just a false alarm. Then, if the thinking brain confirms the threat is real, it temporarily goes offline and the emotional brain takes over and starts the fight or flight response. Hormones, including adrenaline and cortisol, are released to give the body the energy to fight or flee and to calm down once the threat has passed. Changes that happen when the stress response is activated include increased heart rate and blood pressure, rapid breathing, sweating, tunnel vision, and difficulty thinking clearly. And when neither fighting or fleeing is an option, in the moment we may freeze or shut down during a threatening situation. And for younger children who cannot fight or flee, shutting down may be their best option for dealing with overwhelming stress. Then finally, once the threat has passed, the thinking brain helps shut off the alarm and the body puts the brakes on to allow us to calm down and come back into balance. Next slide. So it's important to remember that not every experience that sets off the stress response is traumatic. As Mrs. Hargrove discussed earlier, an experience becomes traumatic when it overwhelms our system for responding to stress and we are unable to cope. Our attempts to fight or flee are not effective in preventing or managing a threat, and we are left feeling helpless, vulnerable, and out of control. Under these circumstances, the emotional brain continues to sound the alarm and send messages to fight or flee even after the threat has passed. Our alarm system becomes overly sensitive to any potential threat and may even start reading non-threatening situations as dangerous. For a period of time, we may remain in survival mode and the body struggles to come back into balance. And as a result, traumatic events may have short and long-term effects on our daily functioning. Trauma triggers are reminders of past traumatic experiences that automatically cause the body to react as if the traumatic event is happening again in that moment. Trauma reminders include sights, sounds, smells, feelings, or situations related to a previous traumatic event. When faced with a trauma reminder, our emotional brain assumes the danger is real without having the thinking brain check things out. This allows us to move quickly into action, which can be critical to our survival in some circumstances. For example, if a child has experienced a violent environment, reacting automatically to signs of danger, like a slammed door, raised voice, threatening tone, or gesture, helps the child stay safe. This automatic response is less helpful during the school day when an environment becomes loud or chaotic and that same child has an intense fight or flight response. In these moments, the thinking brain is offline and the body does not always know whether it's reacting to an actional threat or a false alarm. Triggers set off responses that can appear confusing and out of place to others and can be easily misunderstood when taken at face value. For example, in a school or home setting, fight or flight behaviors may be misinterpreted as purposefully aggressive, rude, defiant, or lazy. When a child is triggered, it is important to remember that they're not able to access that rational or thinking brain, and trying to convince someone in this state that they're overreacting or threatening punishment may cause further harm. So, potential trauma-related triggers for children and youth include some of the following: loud noises, physical touch, threatening gestures, authority figures and limit setting, chaos or uncertainty, particular spaces such as bathrooms or areas that are dimly lit or less monitored, changes in routine, hand or body gestures perceived as threatening, witnessing violence between others, emergency vehicles and police or fire personnel, certain smells, weather, and particular times of year. Common responses to trauma-related triggers for youth include the following: fight responses, such as yelling, swearing, posturing, or aggressive behavior; flight responses that include running away, refusing to talk, avoidance and substance use; and freeze responses such as spacing out and appearing numb, disconnected, confused, or unresponsive. I'm now going to turn it over to Dr. Kaselka, who will talk about the impact of exposure to trauma.
Good afternoon. So in this section, we're going to review the risk and protective factors, some post-trauma pathways, and some effects of complex trauma. Next slide. In part 2, we did review many reactions for children and adolescents that we might notice when they've been exposed to trauma, but how well a child can bounce back is often influenced by a variety of risk and protective factors. Individual and environmental factors that might impact a response to trauma, and the risk then for mental health issues like PTSD or post-traumatic stress disorder include things like biological characteristics, family relationships, your cultural or belief systems, and social supports like those that we have from schools and communities. Next slide. So some of these risk and protective factors include things like a history of previous exposure to trauma. So the more traumatic experiences or the more times an individual has been exposed to a traumatic situation, the greater the risk for some negative outcomes like a diagnosable PTSD. The age of exposure also is an impacting factor. The earlier the exposure happens with trauma, the more the developing brain can be impacted by that, and therefore there can be more profound negative effects for children exposed at an early age. Gender may also be considered a risk factor. There has been some research to suggest that girls can tend to have be more at risk for trauma, but again, that might be due to the type of trauma that girls tend to be exposed to, like a sexual assault or abuse. Cognitive ability also plays a role. Higher cognitive ability tends to be associated with strong reasoning skills and problem-solving skills, also strong information processing. And these skills enable children to manage adversity more effectively. We also know that high cognitive skills are associated with academic success, and there are social connections that occur in groups where there are, when you're having academic success. And so these strong skills can also be protective factors. Additionally, strong executive functioning and self-regulation skills increase children's ability to cope with trauma. Self-efficacy, or the belief in someone's ability to deal with situations, influences how kids cope as well. That strong sense of self-control and competency is considered a protective factor. Other biological factors like flexible thinking and emotional regulation skills also can play a role. Those skills enable the child to manage their emotions more effectively, and again, can enhance coping. Next slide. There are also environmental factors that can impact the nature of the traumatic event, can impact how significant the trauma is. Incidences of mass violence and human-made traumas like war or terrorism, or also interpersonal traumas, can have a greater impact. The proximity to the traumatic event is also a significant factor. The closer and more direct the exposure to that event typically results in more intense responses to the trauma. Culture and ethnicity can play a role as well, and these could be considered risk or protective factors. Strong cultural or faith-based communities can be considered protective. The level of social support is also quite important, and probably one of the strongest protective factors, depending on the level of perceived social support. So the actual support or the quality of the relationships in both schools and homes and communities can be an impacting factor in risk or protective factors. The quality of the parent-child relationship, parent mental health, and the parent history of trauma is also quite important. Research has really shown that a strong relationship with one caring adult is the most important protective factor for children. But if a caregiver is not available to be that one caring adult, and they're not available to protect and soothe and help that child solve problems, any adult can fulfill this role. And we do see that this leads to strong resilience in children when they have that one caring adult in their life. The health of the broader community is also an impacting factor. There tends to be a higher incidence of trauma and a greater risk for difficulties coping in communities where there has been a lot of violence, often when communities have also had a high incidence of financial instability, poverty, racism, discrimination. These issues can be traumatic to the entire community and can also increase the risk of exposure to trauma. So now I'm going to talk about the various post-trauma pathways, or the ways in which youth may respond to trauma. Some children are not able to easily recover from a traumatic experience. They may develop more intense reactions over time. And in these cases, some kids experience what we call severe distress. And this tends to occur when the body's attempts to adjust are just not effective in coping with the trauma. And in these cases, the child or youth may require more intensive and individualized support for the severe distress. Next. Another post-trauma pathway is considered decline. In this case, the youth initially appears to be responding well and managing the strain of the traumatic experience, but over time, the stress system becomes exhausted and they're unable to maintain that healthy level of functioning. And these difficulties may begin months or years after the event. So it's really important for caregivers and educators to be cognizant of the fact that if the child is experiencing issues long after what would have been considered a traumatic event, that these responses are not misinterpreted as unrelated to the trauma. In fact, they may just be coming to the surface or coming to light months or years after that traumatic event. Next. Another post-traumatic pathway is considered stable maladaptive functioning. And in these cases, the youth had poor functioning before the trauma, but continues to have poor functioning after the traumatic event. In these cases, the child may have had a history of exposure to adversity for a long-standing period of time, and that makes kids more vulnerable to the continued negative effects or the cumulative effects of trauma. These children are likely to have really significant emotional and behavioral difficulties, and again, may require some professional assistance in managing the trauma. Next. When the post-trauma symptoms continue, worsen, or they start to impact daily life, the child or youth may meet criteria for mental health issues like a post-traumatic stress disorder. Some of the main symptoms of PTSD or things like re-experiencing the trauma, having nightmares or flashbacks, or reactions to trauma reminders. This makes them often feel like they're reliving the experience. They may also have avoidance of trauma reminders and try to avoid people, places, or activities that they once enjoyed because it reminds them of the traumatic experience. They may also have changes to the stress response system where they're always on alert or reactive. Again, we talked about the impact on the brain, and in this case, the emotional brain becomes overreactive and the thinking brain underreactive. So kids tend to see danger everywhere and tend to respond as if they're constantly under attack. They may tend to daydream or appear non-reactive or even blank. Some negative changes in the beliefs about self and others and their mood is another symptom or potential symptom of PTSD. And in this case, a lot of times kids think that they might be to blame for the traumatic situation. Additionally, we would always want to consider some cultural factors related to PTSD symptoms because various cultures may react differently to trauma. A mental health professional would be required to make this diagnosis, but we just wanted to provide some information on what PTSD might look like. Next. So not all post-trauma pathways are negative. As more positive response, another post-traumatic pathway is considered resilience. And resilience is a positive adaptive response to significant adversity. There are many key factors in supporting resilience, and those include things like having an adaptable, caring, supportive relationship with an adult, as I had mentioned earlier. Also, that sense of mastery over events in one's life is increasingly important in being a resilient child. Having those strong executive function skills and self-regulation skills, again, is another key factor. And then having the safe and supportive environments like schools and communities can aid in resilience. And again, affirming faith or cultural traditions can be a positive factor with regard to resilience as well. Next. There's some other things to keep in mind related to resilience. And in these, some other things to think about are that children may demonstrate resilience in one type of a situation, but not in another. So variable responses to different situations is not uncommon. And coping skills that support resilience can be developed at any time. So if a child doesn't have those innate coping skills, they can be taught, and oftentimes those can be taught within the school setting. We do tend to have supportive social skills groups where we can teach coping skills. Also, professional counselors or therapists often will support kids with trauma and teach them those coping skills. Children don't tend to develop the capacity to positively adapt to adversity and isolation. They really need support from those caring family members and community members and school community as well. And regardless of individual resources that a child might have, kids who face extreme adversity tend to be significantly impacted. So they may, again, require professional assistance in managing and coping with the trauma. Schools, again, do play an important role in fostering resilience, as we can be that supportive and safe environment. And again, many kids do connect really significantly with their classroom teachers, and that person can be that one caring adult that child may need to develop resilience. Next. Another positive pathway is considered recovery. And so some kids return to an earlier level of health and well-being, but not before experiencing a bit of a longer period of disruption. The process may take a while for some kids and may take longer for some individuals than others with similar experiences. We must really be flexible in understanding that each person's time frame in dealing and coping with trauma can differ, and we can't make assumptions about what that recovery should look like or how quickly it should happen. Next. Finally, another possible post-trauma pathway is considered growth, which means that there's a positive change or a transformation as a result of the traumatic experience. More research on growth has been done with adults, but some early research with children has indicated that some youth do report a stronger positive sense of self, increased sensitivity to others, and new ways of understanding and developing meaning to their world and their lives. Next. Now we're going to discuss the effects of complex trauma. As mentioned before, exposure to trauma that starts early in life can really alter how the brain develops and can have lasting long-term effects. We're going to review some key concepts related to brain development now. Next. Brain development is influenced by various factors like genetics, the environment, and early experiences. Genes do provide a blueprint for the brain to develop, but the environment really has a strong influence over brain development. So things like exposure to toxic substances, lead, nicotine, et cetera, can disrupt early brain development. And the experiences that an individual has, like the quality of the parent-child relationship, the support in schools, exposure to stress, continues to influence brain development. Next. So as we said earlier, some level of stress is healthy and a normal part of life. And some negative stressors like losing a parent or coping with divorce can be tolerable with support from others. But chronic stress can lead to damage of the brain, and that's called a toxic stress response. In this case, the brain is under constant threat. The emotional brain, again, becomes overreactive and constantly in survival mode, and the thinking brain tends to be underdeveloped. Exposure to constant threat means the emotional brain is in that survival mode, and it leads to things like an increased heart rate, increased body temperature, and anxiety. The youth tend to be constantly on guard for threats and tend to be mistrustful and overly reactive. They may be quick to escalate, have learning difficulties, or behavioral concerns. When the youth is under constant threat, again, that thinking brain is underdeveloped, and the brain regions tend to be smaller and have fewer connections. Next. So youth with complex trauma see the world as threatening, and there are key areas affected by complex trauma. Things like relationships are affected. Kids who have complex trauma tend to have difficulties trusting. Even once trusted adults, they may have difficulty trusting them in the future. They have difficulties possibly with emotional regulation, which would be difficulties managing their feelings and adjusting and determining when and how to cope with various emotional situations. They may have difficulties with behavior. They may appear aggressive or defensive or disconnected. And these behaviors are coping mechanisms and are related to physiological dysregulation. They may have trouble with cognition in areas like problems with attention or concentration, learning, memory, and reasoning. Sometimes they may engage in dissociation, which may look like daydreaming or a lack of emotions, where they may black out or disconnect from the present moment. And again, another key area affected by complex trauma is their self-concept and future orientation. Oftentimes kids, in this case, feel a low sense of self-esteem, lack of motivation, have difficulties with planning, and a sense of hopelessness. Now I'll turn the presentation over to Dr. Miriam Ferguson.
Hello, everybody. So I'm going to wrap up our presentation by talking about the impact of trauma on children and families. So the majority of school-age children have been or will be exposed to at least one potentially traumatic event in their lifetime, including experiencing a traumatic event directly, witnessing an event, or hearing about an event that affects somebody they know. Whether these experiences happen at home or at school or in the community, the effects of trauma will be felt in all of those areas. Children who are exposed to more traumatic experiences will have the most negative effect on their social and academic success, and those impacts will become more pronounced. Students exposed to trauma may have any of the following reactions. So physical symptoms such as headaches, stomach aches, poor appetite, or that decline in self-care. They might have intense feelings of fear, anxiety, or concern for their safety. They might have difficulty identifying how they're feeling and controlling their emotional reactions. They might have angry or aggressive outbursts, a desire to withdraw from peers or adults, that tendency to engage in risk-taking behaviors, and they may have trouble trusting adults, peers, reading social cues, and developing those relationships. Like I said, trauma can impact a child's performance academically, and those effects might manifest as any of the following. So difficulty paying attention and learning, increased time out of the classroom, increased isolation, frequent school absences, more suspensions or expulsions, a higher referral rate to special education, and poor test scores, and an increased risk of failing grades. Trauma can also impact parents and families. So parents or adult caregivers might also have their own history of trauma, particularly that chronic trauma, and they may struggle with many of the same challenges that we described for children. And parents with a negative or traumatic experience related to even school might be distrustful of educators or the education system, and might have difficulty forming those relationships with school staff. Parents with their own trauma might also struggle managing with their own emotions, controlling their own behaviors. They might have difficulty forming relationships. They might be at increased risk for challenges such as substance abuse, depression, or PTSD, which can negatively impact parenting or their children's behaviors at school. They might have trouble managing their own stress related to their child's behavioral difficulties, especially if those difficulties remind them of their own experiences in childhood. Parents may also feel embarrassed, might have feelings of shame or fear or guilt about their child's behaviors and needs, and they might have difficulty helping their own children cope. When interacting with children who have been traumatized, parents or adults are also at risk of being indirectly traumatized as a result about hearing of their child's traumatic experiencing and witnessing the negative effects. The term for this is called secondary traumatic stress, and it refers to the presence of PTSD symptoms that are caused by indirect exposure to other people's traumatic events. Another term for this is called compassion fatigue. And symptoms of this might be increased anxiety or concern about safety, intrusive or negative thoughts or images related to the traumatic stories, fatigue or physical complaints, feeling numb or detached from their child, or feeling powerless and hopeless, and physically or emotionally withdrawing from people or situations that might trigger those difficult emotions or feelings. Some resources available to kind of manage that secondary stress include exercising, resting, relaxing, having creative outlets, seeking individual or even family counseling, developing a self-care routine, identifying skills and strategies that work for you, learning when to set limits when necessary. And there's a number of different apps that you can also use to help meditate and remain calm. And you can jot those down if you're interested. So what can you do for your child? You want to start by just recognizing and being sensitive to the fact that there are problem behaviors and that they might be a manifestation of that trauma-related anxiety. You can also help your child manage their feelings by teaching and modeling effective coping strategies for them. You can also answer their questions related to the traumatic event in an honest and developmentally appropriate way. So using appropriate language and terms. Create a clear and concrete safety plan with your child. You can also engage them in different activities that stimulate their mind and body and help them expand their feelings vocabulary so they can more easily express themselves. You can also promote different family activities to help bring them closer to the people that care about them and love them. Try to maintain that usual routine and watch for any significant changes in their behavior. Allow your child to tell you their story of the trauma, the way that they experienced it as they see it, and that will help them begin to release their emotions and start to make sense of what happened. And when doing this, you always want to respond compassionately, try not to display shock or judgment, and really just help them kind of understand the trauma in their own way. And you want to reassure children that the adults in their life, including family and school staff, that they're all there to work to keep them safe. And always make sure to set boundaries and limits if necessary, and try to be consistent and exhibit patience when working with your child. You can also just frequently remind them that you care, that you're there for them, that you love them. Try to give them choices that helps them regain that sense of control over their life. Encourage and support them. Anticipate any sort of possible reminders, any challenging times or situations that might trigger those reminders of the event, and try to provide additional support during those times. You can also provide children who are acting out with different opportunities to kind of redirect their energy in a helpful way, such as additional responsibilities or activities, leadership roles. And of course, if the child's symptoms do not decrease over time, or if they're severely impacting their day-to-day activities, or if any significant changes are noted, you do want to refer to a mental health professional. And lastly, I will turn it over to our social workers to talk about some specific resources in our community.
Good afternoon. I'm Jason Greathouse. Tim and I are going to talk a little bit more about resources for parents and for students who are dealing with trauma. Tim, if you want to go to the next slide, or I guess it's Miriam. Thanks. So just a few of the organizations and support groups. Some of these are national that you could utilize for yourself or for your student if they're experiencing trauma. Just this list, this whole slide will be available for you guys if you want to watch it. It'll be on Facebook, or not on Facebook, on YouTube. And if you would want access to it, you could always email one of us and we can provide you with our presentation. So go ahead to the next slide, please. Some more resources, the Project Reassure, the PIT program, which is local here, the National Child Traumatic Stress Network, Anxiety Disorders Associations of America, And there's also an app that was recommended, the PTSD Coach. There's also some books that could be utilized, as a resource for parents when dealing with trauma. Go to the next slide, please. In the school system, we do have the Student Assistance Program at North Hill School District. We have this at every level, whether it's elementary, middle school, or high school. And the primary goal of the Student Assistance Program is to help students overcome any type of barrier to learning so that they can be successful. Now, clearly, trauma can be a barrier for students. Student assistants, they don't diagnose, treat, or refer to treatment, but they may refer to a screening or assessment for screening. So there are 4 phases to the Student Assistance Program. The first one is a referral, and anyone can make a referral. It could be a parent, teacher, fellow student, or the student themselves. They make a referral to one of our school counselors or our student assistance specialists. And at that point, then the team would meet. Our teams meet weekly, which would include our school counselors, our student assistance specialists, our nurses, our principals, who come together to really kind of come up with a plan. What's the best approach? How can we best help this student who's dealing with whatever it may be, whether it's trauma or some other life event that is going on? Go ahead to the next slide, please. The third phase is the intervention and recommendations. So the team assists in linking the student and the family to community-based services, or it may even be school-based services, whether it be a school group, meeting with one of our counselors, student assistance specialists. And then the 4th step is the support and follow-up. The SAP team continues to work with the family and support the student. Follow-ups include monitoring, mentoring, and motivating for academic success. So as far as if you just are really at a point where I'm not sure exactly what to do, the Student Assistance Program is a great place to start, because then you can have the school and all of our resources come together and give recommendations on where to go next. Go ahead, next slide. This will be Tim McDowell.
Thanks, Jason. So as Jason mentioned, there's, the school support, but then there's also the outside community support as well. Some of that will depend on whether it's more of an urgent crisis type situation. Obviously 911 is for extreme emergencies. Resolve is also a resource for kids in crisis to rely on. There's the crisis text line, National Suicide Prevention Lifeline. There's the PA Child Line. There's also a mobile app, Safe to Say, which has become pretty popular, and a lot of students have that app on their phone, and parents can access it too, where it's a good way to be able to report something if you do know of your child or another child that's in crisis, and it helps get some professionals involved. And again, we always encourage kids to tell a trusted adult, whether it's something that they're going through or their friends going through. If we could get a trusted adult involved, then we know that we can keep that child safe and help them through that process. Next slide, please. So there's a lot of other also community supports that deal a lot with education, talk a lot about what trauma is, offer resources, some that help foster connections with other people, families, kids that have gone through trauma, to increase that kind of support connection to people dealing with the same issues. So there's the National Institute of Mental Health. There's also the National Alliance on Mental Illness. Again, I mentioned the crisis text line for the emergencies, mentioned Resolve for the crisis support. And then there's also the 1-887 You Can, which is also another support line. Next slide, please. So what I want to really, I guess, kind of stress too is while there's a lot of national and local resources, there's the SAP program through the school district. Also want to encourage you to really consider strongly individual therapy for your child. As somebody that has worked in private practice with many adults, I can tell you almost every single adult in their 30s, 40s is always trying to go back and re-deal with that trauma. They're seeking out therapy, later in life because they realize the impact of that trauma, how it's affected the quality of their life over the last 30, 40 years. And even as grown adults are trying to go back and make sense of that experience, make sense of what happened, come to process it and get some relief from some of those post-traumatic symptoms. So again, I would encourage you to seek out individual therapy. As Jason mentioned, if you have trouble finding that, reach out to the school, your school counselor, the school student assistance coordinator. We can help you navigate some of those processes where you can find individual therapy. Highmark Caring Place is a good place for grief support for the death or loss of a loved one. Crisis Center North is another local agency to help, as well as Anchor Point Counseling. Next. Again, back to the National Suicide Prevention Lifeline Crisis Support. Safe to say, these are kind of more of immediate hotline types of resources and reporting things when there's a concern for somebody to mobilize some adults to try to keep somebody safe. Again, there's if you are having trouble seeking out individual therapy, either because you don't currently have health benefits for your child or different things like that, there are other resources that through student assistance we can help you out with. One of those things is school-based therapy. So we do have Glade Run as a provider that provides school-based therapy within the school setting, which sometimes helps overcome logistic issues, transportation issues, provides it if a child is less likely to want to go to therapy outside of school, but is willing to see a therapist within their school day. We can make that happen as well. Holy Family Institute is another great resource as well. The website is listed there as well. Next slide, please. And I think that concludes my part. We would like to welcome or like to thank everybody for joining us today. Hope you found it very informative, very helpful. We appreciate you taking time out to join us. If you do have any questions, we'd encourage you to certainly reach out. I don't know if Dr. Bazilla, if you're still on.
Yes, I'm here. Thank you, Tim. Again, I wanted to thank everyone for attending today. This was one of the trainings that we were offering this year, and our plans moving into the fall and into next school year are to strategically schedule trainings that scaffold upon one another to help provide families with more information and additional resources on topics that we're able, to identify that we feel that our community and our students would get the most out of in terms of resources and just that knowledge base that we can provide to you. But as Mr. McDowell said, we do encourage that if you have questions or concerns about your family, your child, to reach out to one of our school psychologists. You can certainly contact my office and I can point you in the right direction. Your school counselor, both social workers are available. And again, we thank you for attending.